Apprehension, anxiety, nervousness, these are common words used to describe how many patients feel before undergoing a procedure for a serious condition. And no wonder.
We're going to be using this to poke a hole across the atrium, from the right atrium to the left atrium. And Mackenzie's going to give us a nice echocardiographic view to help guide us. The thing that really excites doctors is the fact that people will have less strokes and maybe live longer. That gets us excited. That makes us go, wow.
Atrial fibrillation, called AFib, is a condition characterized by rapid, irregular heartbeat and high risk of stroke.
There had already been data that 90% of the clots that cause strokes and atrial fibrillation come from the left atrial appendage. Why is that? Why do people with atrial fibrillation have risk for stroke at all? And it has to do with the way the upper chambers contract. They normally contract in our normal rhythm in a synchronized fashion, with all the muscles contracting at the same time to allow squeeze and transport of blood from the upper chambers to the lower chambers. When you're in atrial fibrillation, it is chaos. Every fiber is contracting, and the net effect is not much contraction. The difference is kind of like an army with the general counting off left, right, and everybody stepping in unison, compared to, the army in complete chaos and everybody doing what they want.
When that happens, blood doesn't move the way it should, increasing the risk for blood clots and stroke.
Clot forms in the left atrial appendage during atrial fibrillation, and that clot can be shot out into the arterial system and subsequently up into the brain, and that's what causes an embolic or a clot-related stroke in atrial fibrillation.
That's where Dr. Sanchez comes in, implanting the Watchman left atrial appendage closure device. So what exactly is Watchman? The filter-like device looks like a jellyfish. The procedure may be done in a catheterization laboratory, like this one.
We basically stick their vein here in the groin area and gain access with a single sheath. It's like a large IV. We're able to then put a wire up into the heart from there that runs all the way up. We then are able to move our tube, our sheath, into the left upper chamber. And then over a series of other catheters, including a pigtail catheter, which actually I can show you, one right here. Here's a pigtail catheter. We're able to maneuver the pigtail catheter into that appendage, into that chamber. We then get a device which is pre-packaged into a large tube and scrunched down almost like a stent, and then we feed that up into the tube. And then the process really becomes really an unsheathing of it. We don't really advance it. We take it to where we already have the tip of the tube, and we draw back the outer covering until it pops open into position.
To prevent clots from forming, decreasing the risk of stroke.
You're a little bit more anterior, yeah. Nice and slow right here, especially here. It's going to try to push you back, and just don't let it.
Excellent.
Nice, a lot better. Breathe.
That looks wonderful. That
Yeah,
looks exactly
good job.
where we want it to go.
Dr. Sanchez says the data shows benefits to Watchman over the leading warfarin blood thinners, such as Coumadin.
There's a drop in the risk of hemorrhagic stroke or stroke from bleeding, which is a risk when you take any of the blood thinners. The Watchman device had a similar stroke risk as patients on Coumadin, equivalent, meaning that the device itself, without being on Coumadin, having stopped all blood thinners, decreased the risk for stroke the same as being on a blood thinner, but without being on that blood thinner.
For Innovations, I'm Kathleen Berger.